Okay, hi, I'm Shanae. I'm going to be demonstrating how to do an insulin continuous infusion through colleague guardian, as well as doing a chest tube dressing, as well as my safety checks. So I'm just going to go in the room performing my hand hygiene. I'm going to do my 2 patient identifiers and make sure my patient's in a comfortable position and that they're doing well. Scotland, Bryson, bin number 1, 2, 3, 4, 5, 6, 7, 8, and their birthday, 24 years old. Can you state your name and birthday and any allergies for me? Okay, so today we're going to be doing your insulin continuous infusion. That's because of your uncontrolled high blood glucose levels. We're going to be monitoring your glucose levels throughout this, just to ensure that your blood glucose is in the doctor's ordered range. They have the ability to decline at this time if they so choose. I'm also going to be changing your chest tube dressing because of your pneumothorax from your accident. Okay, so I'm just going to do some hand hygiene here, and I'm going to perform my first check. So I've already confirmed with my doctor's order on the monograph. So I'm just going to take my MAR here, and it's going to be my MAR to my prepared medication that the second nurse has already done. So right patient, Bryson, Scotland, right drug, insulin R, humulin R. The volume in here is 101 milliliters, so I have 100 units with the right dose, and then the concentration is 0.99 units per ml. The time is now, and the route, as the doctor has prescribed, is going to be through the peripheral IV. Okay, so now that I've done my first check, I'm going to set up the pump here. So I've already done my calculation through colleague guardian, so I have the 2 mLs per hour, and I'd also like to note that I have no ports on anything here. So I'm just going to go into colleague guardian, and I'm going to choose insulin. Okay, so select. Okay, so it's already set up the drug amount, the diluent volume, as well as the concentration. So the dose that I'm giving is, as per ordered, 2 units per hour, and it gives me the rate that I already checked with the 2 milliliters per hour. I'm just going to confirm the primary. Okay, so now before I infuse anything, I need to confirm that my patient has the right medication doing my second med check. So right patient, Ryerson, Scotland, insulin R, humulin R, okay, dose is 100 units. We have the 100 units running at the 2 units per hour, as per ordered. 100 ml normal saline plus the 1 milliliter, so that's 101 for a unit, or concentration of 0.99 units per ml. And the time is now, and the route is going to be through peripheral IV. Okay, so my Y port and my bag here is already primed. The date, time, and initials of the nurse are accurate on here, so that's good. So I already know that this is running and that the vein is open. I'm just going to assess the site. There is no signs of infiltration, swelling, or redness at the site, and they're not experiencing any pain. So to be safe, I'm just going to grab this here, and I'm going to swab.
Okay, third check is done with my second nurse.
So I'm swabbing for 30, allowing to dry for 15, maintaining sterility, and I'm just attaching. I'm not starting anything yet. Okay, so now I'm going to do my third check with my buddy nurse, and she's going to confirm that the MAR to the bag to the pump settings that I have here. So we have the right patient, Ryerson Scott, right drug, insulin R, volume is 101 milliliters, the dose is 100 units, running at 2 units per hour, also 2 milliliters per hour. The time is now, and the route is through the IV, so my second nurse has done that check. So now what I'm going to do is just ensure that everything is opened. And this is still going, I can see the drips there, the vein is open, so now I can start my infusion. Okay, so now that that's running, I'm just going to wait for the 3 drips, perform my hand hygiene. I see the 3 drips going. Okay, so now we're going to start with your chest tube dressing. So I'm just going to move this out of the way here. I'm going to get this set up, and I'm going to start my safety checks. Okay, so first of all, I'm just going to go around to the suction here. My suction's already on. It's in the low suction, which the doctor has ordered. I'm going to make sure that all of these are closed, and I'm going to follow my line, ensuring there's no kinks, bends, or dependent loops in here. I want to make sure everything's draining properly. Okay, so now I'll just go over the drainage system with you. So this is the drainage collection chamber. So at the start of my shift, I'd take a Sharpie or a piece of tape just to indicate how much drainage is in there, noting the color of the drainage as well as the consistency, so I know how much is done by the end. The suction is on to 20 as per ordered, and I can see that it's functioning by the orange ball here. In here is the air leak chamber, and I want to see titling oscillating with the patient's breaths. So in here, if I saw jacuzzi bubbles, that would indicate a potential air leak, so I'd want to check that. I may see some champagne bubbles, but continuous jacuzzi bubbles would indicate an air leak. So I'm just going to go up here. I see that there's the right amount of fluid in that chamber. So right now what I'm going to do is I'm going to take my little forceps here. Where are my clamps? I'm just going to look for my clamps here. They should be part of my safety kit. Maybe I just get my, oh, they're down here. Okay, so they should actually be hanging up here, as well as my safety container. So my safety container includes these, and I'm going to make sure that it includes my normal saline as well as my tape and my normal saline tape and gauze. So what I'm going to do to just check in case there were an air leak, I go closest to the patient, so it is stitched in up till here. So this is what's closest to the patient. Now just take it here. If the continuous bubbling stopped, I'd know that the air leak were in the patient. And then if not, I'd go in continuous intervals down the line just to make sure that I've got the air leak. And then I notify the physician as soon as possible. Okay, so now I'm just gonna get my patient in a comfortable position. He has the right to refuse, he does not. So we're just gonna get you comfortable here, okay? All right, so he is feeling comfy. I have that chest tube exposed. Okay, we'll just move that over here. And I'll grab my hand hygiene bottle. And just get everything ready. So I just have some extra Me Fix in case I need it. Just put that on this table for now.
Now we need my fake dressing.
Just put this here. Now. Okay, I have my gloves in my pocket here.
It's near the water, but it did not go in.
Okay, so I'm going to start by just removing this dressing.
Okay, and then I have my jelonet.
And I want to be pretty quick because that air seal on there, the jelonet, is what's causing it to seal. So I want to be quick when I remove that. So I'm just going to set up my sterile field now.
A little slippery. Maybe I'll use the sharper piece and also continue
This. Okay, so now what I'm going to do is I'm going to start removing this. On Jake, this tape is quite sticky. On a real patient, it doesn't stick quite as much.
So I set up my
And I want to be gentle because I don't want to dislodge the tube. So that's another thing that you check for in your safety check to make sure that the tube is not dislodged. So I'm just going to go through here, being as gentle as possible, stabilizing the tube. There we go. So I'd be noting any drainage or coloring on this tube. I'll just toss this into the garbage here.
the dressing for the tube as well when I'm
Okay, I'll just put this in the garbage, keeping my body open. Okay, so I'm just going to take this off here, pass that to myself.
I'm assessing the site. As I mentioned earlier, when
I don't really need this. We'll just keep it here just in case. So I'm going to change my gloves and perform my hand hygiene.
just be careful when I'm removing it.
Okay, now I'll put on a new set of gloves here.
And so we're going to site
That
with your
one's dirty,
trophy.
so we'll just put on this one. I'll clean that up in just a second here.
Okay. Okay. So I will deal with this afterwards.
Okay.
I'm just going to.
So I'm going to take this, and I'm just going to remove the jelonet here. Be very careful to not dislodge the tube. The tube is stitched in a real patient. So now I'm just going to dispose of this over here.
Bubbles are still
I'm going to remove my gloves and I'm going to perform hand hygiene.
Don some clean gloves.
Okay, so I'm just going to take my extra forceps here.
I would have an extra.
I'm just going to pass myself my garbage bag. Can I set my garbage bag up over here?
Okay, first step.
Okay, thank you. Okay, so I'm just going to put on another set of clean gloves
So I did not contaminate the knife. Push these out.
after performing my hand hygiene. I'm just going to add
Start out with
a little bit of normal saline here. Okay,
so I'll make my rosettes. Okay.
passing
So
these to
usually
myself.
these are waterproof on either side, but because this one.
So I'm also assessing the site. Before I remove that dressing, I should have assessed the site for subcutaneous emphysema. I could still do that by palpating around the area, not by the stoma there. And I just note the color and drainage of the stoma. So I'm just going to open my jelonet right now.
Okay. So I will use the circle motion all the way around.
Just add that into my sterile field.
The tips of my forceps slightly touch the chest tube, so I can add
My garbage. And I'm also going to grab my drainage site.
We'll just verbalize that.
Those, that's in the garbage. Okay, so now I'm going to begin cleansing my patient's
A
site.
little rosette here.
So I'm just going to make my
You guys,
rosette.
there's 20.5 minutes in case you want to do another take.
I'll do one more around, kind of further
So I'm just
out.
going to do a half circle, keeping my forceps down, dropping my garbage 6 inches above.
And I'm going to do one more wet gauze down the length of the tube.
Okay, and then we'll just do underneath, dropping above,
Clean that a bit.
not touching any of my garbage. And now I'm just going to cleanse the top of the tube. The bottom of the tube is stitched into my patient, so I'm just going to be very sure to just move that top portion. Drop. Okay, so now I'm just going to start the drying process.
This is squished out and dried off, so I'll just go down the length
Okay,
of the tube.
so
Bit.
keeping
It's one
forceps
swipe
down.
per swipe. I got underneath the tube when I did underneath the dressing. Okay, so now I just have to dry it off.
Underneath. And now I'll just do the top of the tube.
Okay, again.
So top of the tube is done.
Swipe.
Okay,
Okay.
so now that that's done, I'm going to do my jelonet. So I'm just going to take my jelonet here.
In reality, the chest tube would not move out of place. So again.
Making sure everything is sterile.
One more. It's completely dry. And then I will do one more just down the length of the tubing.
Staying within that 1 inch border. Okay, so now you want to do this flipping and tubey like motion. Get it wrapped around, and now we're going to make that seal. My forceps are still sterile.
Dried. Now we can put on my jelonet. This is the finicky part. I can feel it.
Alright, so that's nice and tight, keeping that in. Now I'm just going to grab my drainage sponges.
Okay, so I've got this. I'm gonna kind of twist it up like
Keeping
this
that
so it can
center
fit
part
around.
sterile. That's what's important here.
Okay,
Don't
so
want
it's
to touch
pretty
the
wound
middle.
up here.
Okay. Now I'll just take my 4x4 gauze.
Sterile. I'm
Put
going
that over
to
top.
place this around the dressing for the insertion
Put
site.
these on the side. So I'm just going to grab my e-fix tape, which I've already date and timed.
Making sure I do not touch the skin, although it's clean.
And I'm just going to make a fully occlusive dressing.
All the way around. Okay, jelonet on. Just make sure this is dressing site. Get rid of these. Now I put on my straight glasses.
And now this is the important part where I'm going to make it sure it's fully occlusive and that it's tented.
So I will.
So the tenting just ensures that if any pulling is going on in the tube, that it doesn't pull on the patient's site directly.
I'll go go the other way
We'll
now.
just touch it like that there, so it's touching underneath. Okay, so then I'll just clean everything up. I'll lower the bed to a comfortable position, make sure my patient's arm is back in a comfortable position. I'll perform my hand hygiene. I'll document with the nurse on the continuous infusion that we did, as well as noting the stoma site here,
Okay, so they're
as well
overlapping.
as
I just need one for
the drainage findings, and I'm going to make sure that everything's running well, and I think that's it.